In this video, we shall learn about hand washing. In any health facility, sepsis is the most important cause of neonatal death. The first and the foremost step in prevention of infections is hand washing. Hand washing should be done for at least 2 minutes before entering the unit and for 20 seconds before and after touching any patient. And remember that hand washing is also to be done before and after touching any unsterile surface and fomites. According to the WHO recommendation, hand hygiene with soap and water should be done for 40 to 60 seconds and hand hygiene with alcohol-based formulation should be done for 20 to 30 seconds. We shall now see the 5 moments in which hand washing is indicated. They are before touching a patient, before any aseptic procedure, after body fluid exposure risk, after touching a patient, and last but not the least, after touching patient's surrounding. Hand washing is important before recording any patient parameter, doing chest auscultation, abdominal palpation, or even changing the position of an infant. It is also important before suctioning, any invasive procedure, administering injection, orogastric tube insertion, opening any vascular access system, and preparation of medication. Hand washing is also important after exposure to body fluids. This can happen during suctioning, dressing of a wound, administering injections, manipulation of any fluid sample, insertion of an endotracheal tube, removal of an endotracheal tube, cleaning up urine, feces, vomit, handling waste like bandages, napkins, and pads, or cleaning of contaminated and visibly soiled material or of medical instruments. Simple procedure like after touching a patient after taking pulse, taking the blood pressure of an infant also mandates hand washing. After touching any bed linen or monitoring, that is, anything in the patient's surrounding, hand washing also becomes important. Handling the baby's incubator, handling the warmer, handling the devices attached to the baby, handling the baby's probe, the blood pressure cuff, the IV tubings, the syringes, and the orogastric tube also requires hand washing by the healthcare provider. Each unit should have adequate facilities for hand washing. They include a continuous running water supply and an elbow-operated tap with a soap. Remember, we should use elbow-operated taps for hand washing. This is not ideal for hand washing because there is no elbow-operated tap. Also, the sink is not deep to allow enough space for proper hand washing. Before hand washing, remove the wristwatch, remove the bangles and the rings. Now, roll the sleeves above the elbow. First and foremost, wet your hands with water. Apply enough soap to cover all the hand surfaces until the elbow. Now, close the tap with the elbow and start washing your hands in the following sequence. Rub your hands palm to palm. Then, right palm over the left dorsum with interlaced fingers and vice versa. Then, palm to palm with fingers interlaced, followed by the back of the finger to the opposing palms with the fingers interlocked. Rotational rubbing of left thumb clasped in the right palm has to be done and vice versa to be repeated. Rotational rubbing backwards and forwards with clasped fingers of the right hand in the left palm and vice versa. Then, wrist and the forearm up to the level of the elbow. After washing your hands, always keep them at a higher level than the elbow. Now, close the tap using the elbow. Dry your hands by keeping them vertical by air or using a single-use sterile napkin or a paper. Remember, wet hands transfer pathogens much more readily than dry hands. Never use a common towel for drying the hands. Discard the napkin in the bin kept next to the patient for the respective purpose. Alcohol-based hand rubs can also be used to reduce bacterial colony counts on the hands of healthcare providers so that hospital-acquired infections can be prevented. Alcohol-based hand rubs can be used after drying the hands following hand washing and before and after every routine patient contact. We shall now see the technique of applying alcohol-based hand rub. Apply 2 or 3 press of the product to the palm of one hand. That is, it will be 2 or 3 press on a 500 ml sterilium bottle, which pours out 3 to 5 ml of the sterilium. Rub both the hands together, cover all the surfaces of the hands and the fingers as previously explained in the steps of hand washing. Remember, you need to wait till your hands are completely dry. Do not touch the baby with wet hands. Once dry, your hands are completely safe. Alcohol-based hand rubs are not effective on the hands that are visibly dirty or contaminated with organic materials. In such a scenario, hands must first be washed with soap and water, even if antiseptics are to be used as an adjunctive measure. Some points to remember. Soap and alcohol-based hand rubs should not be used concomitantly. Keep your nails short and pay attention to them while washing your hands. Most microbes on the hands come from beneath the fingernails. Do not wear artificial nails or nail polish. Remember, removing the entire jewelry, which includes the ring, the watches and the bracelets before entering the newborn care unit. Thank you.